Hey everyone, I think we all know healthcare providers are under a lot of pressure these days.
Yeah, it's a tough time to be in healthcare, that's for sure.
And cardiovascular or stroke care.
Oh, absolutely. Those specialties, they always come with a lot of intensity and stress.
Right, and on top of that, everyone's talking about this burnout thing.
Burnout, yeah, it's like the buzzword of the decade.
But what does burnout even really mean for nurses?
Yeah.
Like for nurse educators and nurse scientists, the people who are really driving patient care forward.
It's a good question and a really important one, I think.
Yet even more importantly, what can we actually do about it?
Yeah, how can we actually make a difference and prevent this burnout from, taking over?
Well, lucky for us, the American Heart Association, the AHA, just released a brand new scientific statement that tackles this head-on.
Oh, that's great. I'd love to hear more about that.
Yeah, so it's called Nursing Wellness in Academic and Clinical Cardiovascular and Stroke Nursing in the Journal of the American Heart Association. Huge, and the AHA doesn't sugarcoat the situation either.
Oh, really, Hesso?
They start by highlighting this pretty alarming statistic. In 2021, the nursing workforce lost over 100,000 registered nurses.
Wow, it's a huge number.
It is. It's actually the most significant single-year decline in 4 decades.
4 decades, wow, that's a big red flag. And I bet those losses are felt even more strongly in specialized areas like we were talking about, like cardiovascular and stroke care.
Oh, absolutely. Those are areas where the stakes are already so high and the demands are just intense.
Right. So how does the AHA break down this whole burnout problem?
Well, they get into the nuances by looking at 3 key roles within nursing. Staff nurses working directly with patients, academic educators who are, shaping the next generation, and then the nurse scientists who are, pushing the boundaries of research.
Right. And those aren't always separate roles, are they?
No, not at all. Especially in academic settings, you see a lot of nurses juggling multiple roles, which just adds another layer of complexity.
Yeah, that makes sense.
So with that in mind, the AHA looks at what's driving burnout in each of these areas.
Okay, so let's start with the folks on the front lines, the clinicians. What are they up against?
Well, the AHA points to this, perfect storm of chronic issues, right? We're talking about chronic understaffing, grueling hours, pay that often doesn't reflect the demands of the job.
Yeah, I can see how all of that would contribute.
And then you add in the constant exposure to death and suffering, which is just, part of the job, but it takes a toll.
Of course, that emotional burden can be huge.
And then there's this thing called moral distress.
Moral distress. Now, that's not one I hear very often.
Right. It's basically when nurses feel like they can't provide the best possible care because of, institutional constraints.
Ah, I see. They know what the patient needs, but maybe hospital policies or something prevent them from doing it.
Exactly. And that can create a real sense of conflict and frustration.
Yeah, I bet that would really wear a person down after a while.
Absolutely. And then, we can't forget about the elephant in the room, the COVID-19 pandemic.
Oh, right. I can only imagine how much that added to the pressure cooker environment.
Oh, it was massive. I mean, we've all heard stories from nurses about how incredibly challenging the past few years have been, and the AHA acknowledges that the pandemic really just exacerbated these existing problems and brought the issue of nurse well-being, into sharp focus.
It's like it took a global crisis to finally make people pay attention.
Right. But even beyond those, broader challenges, there are some role-specific factors that the AHA points to.
Okay, let's get into that. What are they seeing in the world of nurse educators?
Well, it's a little ironic, actually. One of the biggest issues is faculty shortages.
Ironic. How so?
Well, because we need more nurses, right? That's the whole point of having nurse educators, to train the next generation.
Yeah.
But the educators themselves are facing these crushing workloads, often because there simply aren't enough of them to go around.
Yeah, that's a self-perpetuating cycle. So fewer educators means heavier workloads, which leads to burnout, which makes it harder to attract and retain new educators, and so on.
Exactly. And then on top of that, you have the whole shift to online learning, which is definitely blurred the lines between work and life.
Oh yeah, I can see how that would be a challenge. You're always on, always available.
Right. And that makes it even harder to disconnect and recharge.
So we've got faculty shortages, blurred boundaries. What else is contributing to burnout among educators?
Well, there's also the issue of compensation. Salaries and support for nurse educators often lag behind what's offered in clinical settings.
So they're being asked to do this incredibly important work of training the next generation of nurses, but they're not being compensated or supported in a way that reflects that importance.
Exactly. And that can create a real sense of feeling undervalued. which just contributes to the burnout cycle.
It's like we're setting them up to fail, right? We need them to be at their best, but the system itself is working against them.
Right, and that same sense of being undervalued, unfortunately, isn't limited to educators. The AHA found similar challenges for nurse scientists.
Now, these are the folks who are, like, pushing the boundaries of research in cardiovascular care, right?
Exactly. They're doing the work that's going to lead to new treatments, new therapies, better outcomes for patients, but they're often stuck in a system that makes it incredibly difficult for them to succeed.
Okay, so what are some of the biggest hurdles they're facing?
Well, a lot of the same issues we see with educators, actually. Heavy workloads, intense pressure to secure funding in an incredibly competitive environment, this constant struggle to balance research with teaching and administrative duties.
It's like they're being pulled in a million different directions.
Right, and then there's the whole pressure cooker of achieving tenure, which is, its own beast, all while also mentoring students.
Wow, that's a lot to handle. I can see how that would lead to burnout pretty quickly.
Absolutely. But the good news is, the AHA doesn't just leave us hanging with this laundry list of problems. They offer some potential solutions too.
Okay, that's good to hear. Because all of this sounds pretty bleak.
It is, but there's hope. And what's especially helpful for those of you in leadership positions is that they offer tailored strategies for each of these roles, recognizing that a one-size-fits-all approach just isn't going to cut it.
That's great. So it's not just generic advice, it's actually specific to the unique challenges these different nurses are facing.
Exactly. So let's start with the folks on the front lines, the clinicians. What can we do to support their well-being?
Yeah, let's hear those practical solutions.
Well, the AHA really stresses the importance of a multi-pronged approach. So we're talking about individual support, like providing access to mindfulness training or communication skills training. But it's equally important to create a more supportive work environment overall, with flexible scheduling options, strong peer support networks, and recognition programs that make nurses feel valued for their contributions.
So it's not just about teaching individual nurses how to cope with stress, it's about creating a workplace culture that prioritizes well-being.
Precisely. And then there's the potential for technology to play a larger role too. Wider adoption of certain technologies could help ease the documentation burden, for example, and free up nurses to spend more time on what they actually went into nursing to do, direct patient care.
Yeah, I can see how that would make a big difference.
But of course, we can't ignore those deeper systemic issues, like understaffing and inadequate pay.
Right, those feel like bigger, more complex problems that individual hospitals or even individual leaders might not be able to fully solve on their own.
You're absolutely right, and the AHA acknowledges that. Those are systemic issues that require larger-scale solutions. But the statement emphasizes that even within those limitations, there are steps that nursing leadership can take to advocate for their staff and create a more supportive environment.
So it's about being a voice for nurses, pushing for change at higher levels, and making the most of the resources you do have to create a better workplace, even if you can't solve every problem overnight.
Exactly, and that same principle applies to supporting nurse educators and scientists.
Okay, so let's dive into that then. What does the AHA recommend for those in charge of nursing education programs?
Well, they highlight a few key areas. First, robust mentoring is crucial, especially for early career faculty.
Yeah, having a seasoned mentor can make all the difference in those early years when you're still figuring things out.
Absolutely, and it goes hand in hand with providing effective training on teaching strategies, so new educators feel confident and prepared.
Right, because teaching is a skill. It's not something you just automatically know how to do.
Exactly. And then addressing those workload inequities is vital.
So advocating for additional faculty positions, redistributing workloads more fairly, or finding other ways to ease the burden on educators.
Right. It's about being proactive, recognizing that educators need support to thrive, and not just throwing them into the deep end and expecting them to figure it out on their own.
It's about setting them up for success, not for burnout.
Exactly. And creating a supportive leadership structure is just as important.
What do you mean by that?
Well, nurse educators need to feel like they have a voice, that their concerns are heard, and that their leaders are actively working to improve their work environment, even if it's a slow process.
So it's about communication, transparency, and a genuine commitment to supporting educators.
Exactly. And all of that can be challenging, of course, given the budget constraints and bureaucratic hurdles that many academic institutions face.
Oh yeah, those are always factors, but the AHA argues that it's a challenge worth tackling.
They make the point that investing in nurse educators ultimately benefits everyone. A well-supported educator is more likely to be an effective educator, which means better trained nurses, better patient care, and ultimately a stronger healthcare system.
So it's not just about being nice to educators, it's a strategic investment in the future of nursing.
Exactly. And that same logic applies to supporting nurse scientists.
Okay, so what are the recommendations for institutions to better support the critical work that nurse scientists are doing?
Well, first and foremost, providing protected research time. That might mean advocating for dedicated research faculty positions, offering release time from teaching or administrative duties, or finding other creative ways to carve out time for research.
So it's recognizing that research is valuable and deserves dedicated time and resources, not just squeezed in during whatever spare moments a nurse scientist can find.
Precisely. And it's not just about time, it's also about providing resources, offering grant writing assistance, connecting nurse scientists with statistical experts, making sure they have access to the software and technology they need to conduct their research effectively.
It sounds like a really comprehensive approach.
It is, but here's a question. Is there actually any evidence that these kinds of interventions work? I mean, have we seen positive results in institutions that have implemented these strategies?
That's a great question, and it's something the AHA statement actually addresses. They cite several studies that show a strong correlation between supportive work environments and lower burnout rates among nurses. For example, there was a study published in 2023 in the Journal of Nursing Management, and they found that nurses who reported having supportive leadership, access to professional development opportunities, and a positive workplace culture were significantly less likely to experience burnout.
So it's not just wishful thinking. There's actual data to back up the idea that these interventions can make a real difference.
Exactly, and that's encouraging because it means we're not powerless in the face of this burnout epidemic. There are concrete steps we can take, both as individuals and as leaders, to create a more sustainable and rewarding future for nurses.
That's a powerful message, and I think it's especially important for those in leadership roles to hear that they have the ability to make a positive impact.
Absolutely. Leadership isn't just about managing tasks, it's about creating a vision for a healthier, more sustainable future for nursing, and then working collaboratively to make that vision a reality.
Well said. And to our listeners, whether you're leading a large nursing department or simply trying to create a more supportive environment for your team, the AHA statement is a really valuable resource. It provides a framework for thinking about nurse well-being and a toolbox of potential solutions that you can adapt to your specific context.
It's definitely a must-read for anyone who's serious about addressing the burnout crisis and creating a more positive and sustainable future for nurses.
What does that support actually look like, especially for nurse educators?
Yeah, those are the folks who are shaping the next generation of nurses, so their well-being is critical.
Absolutely, and the AHA actually highlights something I hadn't really considered before. The issue of incivility in academic settings.
Incivility, like bullying or just general negativity.
Yeah, exactly. Apparently it's more common than you might think, and it can really take a toll on morale and contribute to burnout.
I can see that. It's hard enough dealing with the usual stresses of academia without having to deal with rude or disrespectful behavior.
Totally, and the AHA is very clear. This kind of incivility cannot be tolerated. They recommend having like a zero tolerance policy in place to send a clear message that this behavior is not okay.
Policies are great, but I think it's also important to address the root causes of incivility. Like, why is this happening in the first place?
Yeah, that's a good point. What are some of those root causes?
Well, I think a lot of it stems from stress, overwork, and just a general lack of resources.
Makes sense. When people are feeling burned out and overwhelmed, they're not exactly going to be at their best.
Right, they're more likely to snap at someone or just be dismissive or negative.
So, addressing incivility isn't just about telling people to be nicer. It's about creating a work environment where people feel supported and valued, less likely to reach that breaking point.
Exactly. It's about fostering a culture of collaboration and mutual respect. And part of that is equipping people with the skills to navigate difficult situations effectively.
Oh, I like that. Give them the tools to handle conflict constructively.
Exactly. And the AHA actually suggests providing training on things like conflict resolution and communication skills. I think that could go a long way.
Yeah, and it would benefit not only the educators themselves, but also the students, right?
Oh, absolutely. Students are like sponges. They absorb everything. If they see their professors being treated poorly, it sends a message that that kind of behavior is acceptable, which is the last thing we want.
It perpetuates that cycle of negativity.
Exactly. So we need to break that cycle and create a more positive and respectful learning environment for everyone.
Okay, so we've got policies to address incivility, strategies to reduce stress and prevent burnout, training to improve communication and conflict resolution. What else does the AHA recommend for supporting nurse educators?
Well, mentorship is another big one, especially for those who are early in their careers.
Yeah, I can imagine having a seasoned mentor to guide you through those first few years would be invaluable.
Absolutely. And the AHA emphasizes the importance of finding mentors who are not only experienced educators, but who are also good listeners, supportive, and genuinely invested in the success of their mentees.
So it's not just about pairing people up based on expertise, it's about finding a good personality fit, creating a relationship built on trust and mutual respect.
Exactly. And it's a two-way street, too. The mentee needs to be proactive, open to feedback, and willing to put in the work.
Makes sense. Now, the AHA statement doesn't go into a lot of detail on this, but I wanted to touch on the issue of diversity within nursing education.
Oh, absolutely. That's such a crucial piece of the puzzle.
We need a more diverse nursing workforce, not just for, reasons of social justice, but because it leads to better patient care, period.
Can you elaborate on that a bit? How does diversity actually translate to better patient care?
Well, when patients see themselves reflected in the healthcare professionals who are caring for them, it just builds a level of trust and understanding that you can't really get any other way.
So it's about patients feeling seen, feeling like their healthcare providers understand their unique needs and perspectives.
Exactly. And to get to that point, to have that level of representation and cultural sensitivity within nursing, we have to be really intentional about attracting and retaining nurses from diverse backgrounds.
Right, and that means addressing any systemic barriers that might be preventing people from entering or staying in the profession.
What kind of barriers are we talking about here?
It's a complex issue, but some of the factors include financial constraints, lack of access to quality education, and even, implicit biases within the healthcare system itself.
So it's not just about recruitment, it's about creating a truly welcoming and inclusive environment where nurses from all backgrounds feel supported and valued like they belong.
Exactly, and that brings us right back to leadership.
Because leaders are the ones who set the tone and create the culture.
Right. Leaders need to have a vision for a more diverse and inclusive nursing workforce, and they need to be actively working to make that vision a reality.
It's about walking the walk, not just talking the talk.
Totally agreed. Okay, so we've covered a lot of ground in terms of solutions for nurse educators. Now let's shift gears and talk about the AHA's recommendations for supporting nurse scientists.
Yeah, these are the folks who are doing the research that will ultimately lead to better treatments and better outcomes for patients.
Right, so their work is critical, and the AHA makes a strong case for providing them with dedicated time and resources for research.
Okay, so what does that support look like in practice?
Well, it starts with recognizing that research is not something you can just squeeze in during your spare time. It requires dedicated time and effort. So that might mean advocating for dedicated research faculty positions, offering release time from teaching or administrative duties, or finding other creative ways to free up time for research.
So it's about protecting their time, basically, and making sure they have the space and the freedom to focus on their research without constantly being pulled in other directions.
Exactly. And then, of course, it's about providing the necessary resources, too. Grant writing assistance, connections to statistical experts, access to the latest software and technology, all of that is critical.
Those are all really practical, actionable things that leaders can do. But what about mentorship for nurse scientists?
Oh, that's huge, especially in the early stages of a research career. Having that guidance from someone who's been there, done that, can make all the difference.
The AHA actually encourages collaborations between academic institutions and healthcare systems too, right?
Yes. Creating opportunities for nurse scientists to conduct research within clinical settings.
Which makes a lot of sense because it allows researchers to connect their work directly to the needs of patients and practitioners.
Exactly. And it gives nurses who are working in those clinical settings the opportunity to get involved in research too, which can be really enriching and rewarding.
So it's a win-win situation.
Totally. And the AHA goes a step further. They suggest that healthcare systems should actually recognize and reward nurses who are involved in research, even if it's not their primary job.
So it's about creating a culture where research is valued at all levels of the organization.
Precisely. And that can be supported by, offering release time for research or even financial bonuses for publishing findings.
Those are great incentives. Okay, so we've talked about the importance of time, resources, mentorship, and creating a culture that values research. Anything else the AHA recommends for supporting nurse scientists?
One thing that jumped out at me was their recommendation to offer travel funds for conferences.
Why is that so important?
Well, conferences are a great way for nurse scientists to present their findings, network with colleagues, and just stay up to date on the latest research, but they can be expensive, especially for those who are early in their careers.
So providing travel funds removes that financial barrier and allows nurse scientists to fully engage in those professional development opportunities.
Exactly. Plus, it sends a message that the institution values their work and wants them to share their findings with the wider scientific community.
Makes sense. Okay, so we've covered a lot of ground in terms of solutions for both nurse educators and scientists. Is there anything else from the AHA statement that you think is particularly important for leaders to keep in mind as they try to implement these changes?
I think the biggest takeaway is that there's no quick fix for the burnout crisis. It's going to require a sustained, long-term commitment to creating a culture that truly values nurses, supports their well-being, and empowers them to thrive.
It's not a one-time project, it's an ongoing process of continuous improvement.
Exactly. And it requires collaboration and open communication between leaders, educators, scientists, and clinicians, all working together toward a common goal.
It can't be done in silos. It requires a team effort.
Absolutely. Now, was there anything in the statement that particularly surprised you?
You know, one thing that stood out to me was the AHA's emphasis on recognizing clinical work as valuable for nurse scientists.
Interesting. What do you mean by that?
Well, in academic settings, there's often this unspoken hierarchy where research is seen as, more prestigious or more valuable than clinical work. But the AHA is pushing back against that notion.
So they're saying that we should value both research and clinical expertise, recognizing that they both contribute to the advancement of nursing.
Exactly. And I think that's really important because it creates a more inclusive environment for nurse scientists who are passionate about both research and patient care, allows them to bring their full selves to their work.
It bridges that gap between research and practice, which ultimately benefits everyone.
Right, because at the end of the day, it's all about improving patient outcomes. Supporting the well-being of nurses is not just about being nice or doing the right thing. It's a strategic investment in the future of healthcare. When nurses thrive, patients benefit, plain and simple.
Well said.
We talked about those systemic issues, the role-specific challenges.
Creating those supportive environments, addressing incivility.
Mentorship, diversity. I mean, it's a lot.
It is, but it's all connected, you know? It all ties back to this core idea that if we want a healthy healthcare system, we need to take care of the people who are taking care of the patients.
And the EHA statement really drives that point home.
Absolutely. Now, are you ready to get into some more of those specific actions leaders can take?
I am. I'm really eager to hear, what can people actually do with this information?
Right, let's make it practical. Well, one of the first things the AHA recommends is conducting regular assessments of nurse well-being.
Okay, assessments. That makes sense. I mean, you got to know what you're dealing with before you can fix it, right?
Exactly. It's like taking a temperature,
Yeah.
You need that baseline data to track progress and identify any areas that need attention.
So what kind of assessments are we talking about? Just like simple surveys?
Surveys can be a good starting point. They can give you a broad overview of how nurses are feeling and highlight any major concerns.
Right, but I'm guessing it goes deeper than that.
It does. The AHA encourages going beyond just surveys and using a variety of methods like focus groups, individual interviews, even just casual check-ins.
So it's about getting a more nuanced, qualitative understanding of what's going on.
Right. It's not just about numbers. It's about listening to nurses' stories, understanding their experiences, and really hearing what they have to say.
And that requires creating a safe space for them to share honestly.
Absolutely. Nurses need to feel like they can speak up without fear of judgment or retribution. That psychological safety is crucial.
Because if they don't feel safe, they're not going to be honest, and then the data's useless.
Exactly. And it's not enough to just gather data. You have to actually do something with it.
Right. Put it into action. The AHA really emphasizes that point, right?
They do. They say these assessments should be followed by concrete actions to address whatever issues are identified.
So it's not just about checking a box and saying, oh yeah, we care about nurse well-being. It's about actually making tangible changes to improve the work environment.
Exactly. And those changes will look different in every organization. There's no one-size-fits-all solution.
Right. So it might be adjusting staffing ratios, creating more flexible scheduling options, providing more support for professional development.
Or creating more opportunities for nurses to participate in decision-making.
Empowering them to have a voice.
Exactly. It's about being creative, being flexible, and being responsive to the unique needs of your team.
And recognizing that it's a process, right? It's not like you do one assessment and you're done. It's got to be ongoing.
It's a commitment, a continuous effort to create a culture that values nurses and prioritizes their well-being.
And that commitment has to come from all levels of the organization.
Absolutely. From the CEO to the unit manager, everyone needs to be on board.
And it can't just be about lip service either. Like, leadership has to actually walk the walk.
Exactly. It's about modeling the behaviors you want to see in others. If we want nurses to prioritize their well-being, then leaders have to do the same.
So taking breaks, setting boundaries, not glorifying overwork, all that stuff.
Exactly. It's about creating a culture where it's okay to say no, it's okay to take care of yourself, and it's okay to prioritize your own needs.
That's a really important message, especially in healthcare,
Yeah.
where it's so easy to get caught up in the mentality of always putting the needs of others first.
It's a trap, and we have to be mindful of it.
So it's about leading by example, creating a culture where well-being is truly valued.
And empowering nurses to advocate for their own well-being. They need to feel comfortable speaking up, sharing their ideas, and pushing for change.
Because they're the ones on the front lines. They see the problems firsthand.
Exactly. And the AHA talks about creating structures where nurses have a voice in decision-making. Things like shared governance models, or just creating a more open and transparent communication culture.
So it's not about leaders dictating solutions. It's about working together to find the best way forward.
Exactly. And it's about being willing to experiment, to try new things, to learn from what works and what doesn't. There's no magic bullet here, but there are a lot of promising strategies, and the AHA statement is a great roadmap.
It gives you a starting point, a framework for thinking about these issues.
And then it's about being open to trying new things, not being afraid to fail, and celebrating those successes along the way.
Highlighting what's working, sharing those best practices, creating that sense of hope and possibility.
Exactly. So to all our listeners out there, whether you're a CEO, a nurse manager, or just a nurse who cares about making things better, take this information and run with it. Share it with your colleagues, start conversations, and don't be afraid to advocate for change.
The well-being of nurses is directly tied to the quality of patient care. And we all have a responsibility to create a healthcare system where nurses can thrive.
I couldn't have said it better myself. And remember, the AHA's scientific statement, nursing wellness in academic and clinical cardiovascular and stroke nursing, is a fantastic resource. Dig into it, share it, and let's work together to create a better future for nursing.
Because when nurses thrive, everyone benefits. Thanks for listening, and be sure to check out the show notes for a link to the AHA statement and other resources. Disclaimer and bibliography in the description. Go out there and be the change you want to see in healthcare.